Thank you very much. I'm sorry I overstayed my
Emily
time.
yields
I yield.
back. Recognize Mr. Bilirakis, 5 minutes.
Thank you, Mr. Chairman. The Change healthcare ransomware attack is the most consequential health-related cyber attack in our nation's history. It is critical that we not only address the needs of the provider and patient community following the Change attack, but that we are also proactive in preventing similar attacks like this from happening wherever possible. That's why we're having this committee. The subcommittee I chair, the Innovation, Data, and Commerce Subcommittee, is considering draft legislation, landmark legislation, to establish a national data privacy and security standard for consumers, the American Privacy Rights Act. And while that bill exempts HIPAA-compliant entities from a dual regulatory regime, I do think it's important that the entire healthcare sector regularly adopt best practices and take from the bill's principles such as data minimization, vulnerability assessments, information retention and disposal policies, and the use of the privacy-enhancing technologies. So, Mr. Sheldon, I appreciate that in your written testimony you note the importance of the work on the data privacy bill, by the way, led by our distinguished chairperson and our ranking member. What recommendations do you have for the healthcare sector to leverage artificial intelligence, privacy-enhancing technologies, and other best practices to better protect against new threats as they appear? Again, for Mr. Sheldon, please.
Thank you. It's been really quite something to watch, the advancement and development of artificial intelligence over the last year or so, based on consumer applications, but really in the security community, there has been AI and ML in use for a long period of time, years, to identify and defeat novel threats. I think there are some specific applications that people can work on based on this new technology that might relate directly to healthcare, but in general, the most straightforward pathway to get some of these technologies into the hands of people who are providing care is for their service providers, the security technologies and applications that they're using to experiment and integrate those sort of natively into the technologies that they produce. So both of those things will happen, and we'll see more uptake of this sort of technology over time.
Thank you. One piece of legislation I worked on last Congress was the Ransomware Act that required an FTC report on cross-border complaints regarding ransomware attacks committed by our foreign adversaries, as well as recommendations on how to mitigate against ransomware. Mr. McLean and Mr. Garcia, what are some key ways and best practices the healthcare sector broadly can take to protect against ransomware attacks where it's feasible?
Thank you for the question. I commented earlier on some of the best practices that are laid out in NIST frameworks and also the 405D framework about being able to protect ourselves. So I think this happens with technical, administrative, behavioral, and physical controls in our environments. I think the information sharing that happens is extremely valuable to us as we learn about an ever-changing threat landscape. And it is, was asked earlier if this is expensive and time-consuming. It certainly is. It's something that Mr. Sheldon said it's not a destination, it's a journey. This is something we're working on regularly every day, talking about. And because the technology and threats are changing, it's something that we have to regularly upgrade and patch systems and put a lot of effort into working with all of our technology partners to discover vulnerabilities and do that work to be as safe as we can.
Thank you. Mr. Garcia?
I align myself with Mr. McLean's remarks. He mentioned the 405D framework. That is what has resulted in the health industry cybersecurity practices that HHS and the Sector Coordinating Council developed together, first published in early 2019. It is a formulary for how the health industry needs to practice those basic cybersecurity controls that will help us reduce the incidence of ransomware attacks. We just need to get the awareness and the uptake and the implementation across the healthcare industry of those practices. They're there. They're ready to be implemented. And we'll need the help of the government, we'll need the help of the Congress to be sure that the rest of the healthcare community knows that that's available, and they just need to invest in it.
Thank you very much. I appreciate it. I have one more question, but I'll submit it for the record, Mr. Chairman. Thank you. I yield back.
Gentleman yields back. I recognize Ms. Kelly from Illinois, 5 minutes.